So it's a minute past the hour, so we'll just start and people can troop in their own time. So welcome everybody to another edition of our Research Nexus meeting. Today we have our own Dr. Picha, who is an associate professor in the Department of Interdisciplinary Health Sciences, where he co-teaches clinical anatomy. Her research interests are in the areas of social determinants of health in athletic healthcare and patient adherence to rehabilitation, with numerous publications on the topics. Last year, one of her manuscripts was awarded the Clinton Thompson Award for Clinical Advancement through the Journal of Athletic Training. Dr. Picha has secured grant funding both internally and externally, that is JDSU, for her work. She currently serves on several professional committees, including the AACA Branding, Promotion, and Outreach Committee, the NATA Education Advancement Committee, and the AZATA Governmental Affairs Committee. Dr. Picha also serves as a section editor for the Clinical Practice and Athletic Training Journal and serves on the editorial board for the Journal of Sports Rehab. Dr. Picha earned her Bachelor of Athletic Training degree from Minnesota State University, Mankato, a Master of Science degree in post-professional athletic training from A.T. Still University. So she's an alum. I didn't know that. And earned her Doctorate of Philosophy degree in Rehabilitation Sciences from the University of Kentucky. Thank you for talking to us today, Dr. Picha.
Yeah, thank you for having me. ATS, you can't get rid of me. Came back from being a student to postdoc and faculty. I'm really happy to be here. So thank you again for having me. Thank you to all of you who took time out of either your lunch to be here or even later in the afternoon. So thank you. Hopefully you can see the change in the slides, correct? Okay. So just to get started, I put this in there. I don't have anything crazy to disclose, but I do want to make it clear that the work that I've done, despite being funded and despite doing the work here, these are my views and my findings, and so it might not always align with the funding sources or ATSU. So this is kind of my presentation overview for the next 40-ish minutes. I'm going to provide a quick background of what social determinants of health are. I imagine that most of us have been exposed to the concept at some point, so I'm not going to spend a ton of time here, but happy to continue talking about it later on if there are questions or if we want to get into more depth, we can. I'm going to present an overview of the projects I've been working on that have gotten me to this point thus far and the key findings of those projects. And then I'll end with some of my tips for potential success that hopefully will help you if you're going to pursue grant funding in the future. There are several frameworks related to social determinants of health. The World Health Organization has their own, Healthy People present their own. There are ecological models that incorporate perspectives that acknowledge the interactions between social determinants of health as well as community-based organizations and structures. Although these presentations of the frameworks are slightly different, they're all talking about the social factors that influence our health. The World Health Organization specifically describes them as circumstances that are shaped by the distribution of money, power, and resources at various levels, national, local, global levels. Social determinants of health do include the quality and quantity of a variety of resources that a society makes available to its populations. So they're, again, the conditions in which we all live, learn, work, play, and grow. When they're negative and negatively influencing our health, they do prevent positive health outcomes and ultimately lead to health disparities that, again, not only affect the individual, but the population as well. So social determinants of health are one of three priority areas that Healthy People 2030 have or want to address. So along with social determinants of health are health equality and health literacy. Healthy People 2030 has set up data-driven national objectives to address these 5 domains that you can see here on the screen. They include education, access, and quality, economic stability, social community context, as well as healthcare access, and then neighborhood and built environments. Now, these 5 domains encompass a large variety of social determinants of health that can either positively or negatively influence our health and well-being. So to date, much of the focus of the healthcare community and us as healthcare providers tend to focus on what we can do to improve the care we provide, which is great. But we also know at this point that we can provide the best care possible, but that only accounts for about 20% of a patient's health or health outcome. If we aren't addressing or recognizing other factors, predominantly the social determinants of health that affect patients' health, then optimal health for our patients can't possibly be reached. Now, the greater healthcare community has identified, again, the importance of social determinants of health and the impact on individual and population health. And if we aren't recognizing these as healthcare providers, we're truly doing a disservice to our patients and preventing, or not necessarily promoting, the ability to resolve or mitigate these and preventing their optimal health. So I began this work back in 2008 as a postdoctoral fellow with Drs. Valier and Dr. Bacon. We actually pulled Dr. Lewis in as well for one of these projects. But the concept of these projects, or where the ideas came about, was really through a student project. She was working as an athletic trainer on an Indian reservation, and she began to notice that her patients really had limited access to other healthcare providers outside of care. Some of her patients weren't seeing anyone else. She noticed that she was working within a food desert among actually quite a long list of other social factors that she found were really playing a role into her patient's health. Prior to this, she hadn't really considered some of these factors and how they were going to affect her care. And so as we began to work with her and explore further, despite what the greater healthcare community was doing in studying these social factors, we realized that there is quite a large gap or absence of literature in this area within athletic healthcare. So with this, and for me at the time, this was a newly discovered gap and really concept that we couldn't continue to ignore. And at about the same time, there was also some changes that came about with our accrediting body. In 2020, our standards were updated to actually include social determinants of health and health literacy. So I have this standard 57 that was created that specifically calls out those two, because we do need to be addressing these and putting them in practice. So as a newer concept in the world of athletic training, we felt the need to gather some information specifically for athletic trainers. Now, that's where this concept paper came about. We realized again that there wasn't much out there within athletic healthcare. So we did pull what we could from our literature, but really most of this concept paper pulls in from others, other healthcare providers and organizations that are leading the charge and efforts related to social determinants of health and patient. While working on this project, we were fortunate enough to receive a new investigator award through the National Athletic Trainers Association, as well as an internal grant to kind of complement or supplement the external grant. And so this is where we were actually able to start exploring some foundational information on the topic. And so with these two grants, again, I'm calling it my foundational research because it is pretty, because it is our foundation. We didn't have much at the time to go off of. So the purpose of this work, really to get us started, was twofold. One, to evaluate athletic trainers' perceptions about social determinants of health, and secondly, to explore athletic trainers' observation of social determinants of health at the point of care, in the secondary school setting and the collegiate setting. We chose these two settings to start because most of our members of the National Athletic Trainers Association do practice in one of these two settings. So we knew we were capturing a large number of individuals if we did it this way. And so what this kind of looked like is we started with trying to start with that first purpose with understanding athletic trainers' perceptions related to their familiarity, comfort, knowledge, as well as perceptions and experiences. And then we shifted to see what we could gather related to observations of social determinants of health at the point. So again, I'm not going to get into too much detail and depth of the methods for the sake of time, but if there are questions, I'm happy to share any of this information that's been published or disseminate it to you in any way, or again, answer questions. But to answer our first kind of aim, we use a cross-sectional design to evaluate athletic trainers' perceptions related to social determinants of health. We modified a couple surveys that were already out there within different healthcare fields and professions. We did modify it to fit our needs and answer our research questions. We ended up having a survey that was 45 items. We did validate it with content experts and other athletic trainers within the field. The survey took participants about 10 to 15 minutes to complete. And how we administered the survey was through the Qualtrics platform, and emails were sent to about 17,000 athletic trainers that were members of the NATA at the time. We did have it was 1,830 that actually accessed the survey, giving us an access rate of about 11%. However, when we look at who actually completed the survey, we had 1,694 respondents, giving us a completion rate of about 93%, which we were pretty excited about at the time. And so with those participants, most of them were female. On average, they were about 38 years of age and had about 15 years of experience. So now moving into the results of the survey, I'm going to talk through a couple of graphs, and they're all set up the same, but to give you kind of a starting point, we each of the questions that we asked, the responses that the participants could select are along your horizontal axis, and then along the vertical axis are the number of participants that answered that question a certain way. So for this specific graph, it represents the question related to athletic trainers' familiarity with the concept of social determinants of health. They could respond that they're extremely familiar all the way to they weren't familiar at all. And so here, as you can kind of see, the majority of the participants were reported that they were only minimally to moderately familiar with the concept of social determinants of health. And now, at the time we administered this survey, it was actually back in 2019. And so it, again, was a newer concept to the healthcare community or the athletic training community at the time. And so this wasn't really too surprising that this is where our participants fell with this question. The other question that we asked was about their comfort in identifying social determinants of health within their care. Similarly, we only had 3.5% of our participants say they were extremely comfortable with the concept, whereas the majority, again, minimally comfortable to moderately comfortable. Then we also asked what their perceptions about their knowledge about social determinants of health were. Again, 2.7% said they were extremely knowledgeable, whereas the majority said they were minimally to moderately knowledgeable about the concept of social determinants of health. This is actually similar to findings from colleagues that they were looking to explore athletic trainers' knowledge about several public health topics, and they found similarly that ATs did not perform well when it came to knowledge about social determinants of health. So similar findings with them. Now, what I don't have to share here is recognition data. We did provide a list of social determinants of health, health inequalities, and then there were a few other concepts added to a list. And we asked athletic trainers to identify from that list which were social determinants of health. And so despite about 60% of the athletic trainers in the study saying, I'm not knowledgeable or very minimally knowledgeable about social determinants of health, over half were actually able to endorse 8 out of the 9 listed social determinants of health that we included in the survey. And 22% of those did endorse more correct answers than incorrect answers. So this does suggest that there is some level of recognition within this population of athletic trainers, this sample. Without strong feelings of their own knowledge, they are able to at least recognize them, which I think is a very positive outcome of this study. It provides us a foundation and a baseline of where we can start. And although there are improvements that probably can be made in athletic training education globally, not only in the athletic training programs, but with on-the-job learning and CEUs and continuing the research and work in this area, we do have a baseline, and they are recognizing some of these social factors that are playing a role in their patients' health. So within that survey, we also asked athletic trainers' perceptions of social determinants of health specifically and their experiences with specific social determinants of health. So what you're looking at here in this figure along the bottom are the social determinants of health that we asked athletic trainers about, and then along the vertical axis is their percent of agreement with the question. So for example, we asked how important was, we'll stick with income since it's the first one on there, how important is income specifically to your patient's health within the healthcare field? And the majority of participants agreed or strongly agreed that all the social determinants of health that we asked about do have an impact on their patient's health within athletic healthcare. The bars that have the lines through them, that indicates that they strongly agreed. The light gray is that they agreed. And then the darker gray, they disagreed. The black, which we hardly had anyone strongly disagree, which is a great thing to see. And so that's kind of how those bars are laid out there for you. So we also asked if athletic trainers would report on experiences with certain social factors, and most reported having an experience with all that were asked about. Again, despite not having much knowledge or comfort or familiarity with the concept of social determinants of health, they were experiencing having to address some of these things, or at least observed them in their practice working with their patient population. And so along the bottom are the same social determinants of health that you saw on the last slide. Here, the vertical axis is actually the percent of that had experience with that social determinant of health. The light color in the graph is that, yes, they have had experience. The light gray is that no, they haven't. I'm sorry, the dark gray. No, they have not had experience. And the black is that they weren't sure if they have. And so, again, most athletic trainers did report experience with all of these. I do want to point out the top 3 here. We had lifestyle choices, access to healthcare, and then social support. Those were the 3 most commonly reported social determinants of health that athletic trainers at this point said they had experience with. So findings, again, indicate that athletic trainers agree that with other healthcare providers that, yes, social determinants of health are influential to a patient's health and they are important within athletic healthcare. Therefore, increasing athletic trainers' familiarity, comfort, and knowledge about social determinants of health is important to promote greater recognition of social factors that are influencing patients' health. This greater understanding of how social determinants of health influence patient care and well-being to better inform clinical care decisions is ultimately where we want to get to improve those outcomes. and really paying attention to those social factors that were identified to be most commonly experienced in practice could at least help guide athletic trainers and be a starting point for knowing within this population, lifestyle choices, social support, and then access to care are going to be commonly observed or potentially assessed. And so being prepared to mitigate some of those as clinicians is important. Now that was the those two, they ended up being two papers. One, they've both been accepted, and so they are available. And I'm happy to share those if anybody wants those at some point. This next study, we really focused on what athletic trainers were able to observe within their practice. We implemented a observational card study very similar to and actually modeled from one of Dr. Lewis's studies that she conducted with her colleagues within community health centers. Now, with this observational card study, one of the benefits is that you can collect an abundance of prevalence data at one time during a short amount of time. And so we took the card that they used in their study and modified it to better fit athletic training. And this card, I will show you in the next slide, we asked the clinician, the athletic trainers, to complete one card per patient following meaningful patient encounters. So what this meant for us was we didn't want athletic trainers just to hand someone a Band-Aid, say, hi, see ya, here's your Band-Aid. That we didn't count as a meaningful patient encounter. We wanted meaningful patient encounters to include prevention when you're working with athletes or patients to prevent injury during evaluations, treatment, and rehabilitation, where there's some conversation happening. We asked the athletic trainers that participated to collect over 1 to 2 weeks, to collect the cards over 1 to 2 weeks. We provided them with 30 cards. Some, because of the variability within athletic training, this wasn't as, neat and clean as in Dr. Lewis's study, where you've got the consistent patient flow. You know how many patients you're going to see a day. Within athletic training rooms, you don't always know who's going to walk through your door when. So we had to have some flexibility with how we were collecting this data. But ultimately, we did have 27 secondary school athletic trainers from around the country participate, and we had 23 college athletic trainers from around the country participate. Each of the 27 secondary school athletic trainers were from different schools, whereas within the college setting, 20 institutions were represented. So there was a little bit of overlap with the athletic trainers and their sites. So this slide gives you an idea of what the back of the card that we gave to our participants looked like. The front of the card was strictly just instructions to remind them how to complete it. But on the far left-hand column are the listed social factors, listed social determinants of health that the clinicians could potentially see in practice. We do have another box at the end, just in case we might have missed something and the athletic trainers felt like they wanted to add another one that they were commonly seen. It wasn't used very often, but it was there in case people wanted to. Now, if a social determinant of health was observed during that interaction, in the second column, that is where the athletic trainer would check the box. Now, in the third column, we asked that athletic trainers check that box if they deemed or perceived the social determinant of health that was observed to be negatively influencing their patient's health. And then in that last column, we provided the ability for athletic trainers to write in if they did anything about what they were seeing. We did ask that athletic trainers not change their practice. That wasn't the purpose of this study. It was just to gather information on what's being seen and what's being done without changing care at this time. Now you will see there are 2 check boxes at the bottom during some patient interactions. If an athletic trainer wasn't sure if a social determinant of health was observed, or if they didn't see or observe any social factors during that interaction, they could check those boxes as well. And those were used on occasion, but not nearly as much as we anticipated. If I didn't mention before, these cards, they're not big. They were printed on cardstock. They're about 8 by 5 inches, and the idea is it wouldn't take more than 30 seconds of time to complete these calls. So we did break this, some of the results down into secondary school and college settings. And so within the secondary school setting, those 27 athletic trainers, they collected 676 cards. In total, they observed 748 social determinants of health, with the top 3 being academic stressors, social media, and then lack of health literacy. Of those observed social determinants of health, there were 351 that were deemed or perceived to be negatively influencing their patient's health. The top social determinants of health that were observed to be negatively influencing patients' health were health literacy, academic stressors, behavioral health issues, and then individual and family life circumstances. Of those that were deemed to be negatively influencing health, almost 40% of them, athletic trainers were mitigating, or at least attempting to mitigate in some way, shape, or form. Now, another interesting finding from both of these studies that I'll touch on, or both of these populations, is that these social determinants of health here, they're bolded: insufficient lack of health insurance, food insecurity, and homeless or unstable living conditions. They weren't observed most often in these groups. However, when they were observed, they were most likely to also be perceived as negatively influencing patient health. Meaning, if this is being observed within your practice, there should be resources probably in place or direction that you can provide to your patients if they do come up. So in the college setting, there were 424 cards that were collected from our 23 athletic trainers that participated, with 725 being observed within this group. Social media, academic stressors, similar to the secondary school setting, were most often observed, as well as behavioral health issues. Almost 40% of those that were observed were perceived to be negatively influencing health, with academic stressors, behavioral health, and transportation issues being most negatively influential to their health. And here, 25% of the time, athletic trainers mitigated or took action to address these. And here, similar to the secondary school setting, insufficient or lack of health insurance and food insecurities were, when observed, most likely to be negative, with the addition of social support here. Oh, I apologize, this is a little small, but I did want to at least highlight collectively what athletic trainers said they were doing to mitigate the social determinants of health that they felt were negatively influencing patient health. So in the left-hand column are the social determinants of health that were written on the card or printed on the card that could be selected. And then the 4 columns to the right in the lighter colors of blue, those are what was written in the action box. So athletic trainers said that ways in which they mitigate social determinants of health are through counseling and education, providing additional resources, referral to others, and then communication with others. That last column is just totaling the frequencies of how many times something was written in the box related to one of those 4 themes that emerged. So I'll just point out here the top 3 social determinants of health. And again, I blended these for this talk just to kind of highlight what's going on. But with lack of health literacy, behavioral health issues, and the academic stressors, those were the top 3 social determinants of health that athletic trainers are mitigating or attempting to take action in some way, shape, or form within their clinical practice. And so I just kind of highlighted above in that table there for you. Most often, the action taken is really education, which is huge. That is part of our job and something we always have done very well, in my opinion. So just to kind of wrap up this portion of the study, again, athletic trainers are positioned to accurately and consistently assess social determinants of health in their patient populations. They spend a lot of time with their patients. It's not usually just once every couple of weeks. They usually follow up and see them on a regular basis. And so for athletic trainers working in these two settings, being prepared to address some of the commonly observed social factors is really important. And there's things that can be done and put into place ahead of time so that athletic trainers can be a little bit more prepared to mitigate, provide resources and educate their patients when they're perceiving social determinants of health to be negatively influencing their patients. Okay, I'm going to shift gears a little bit and try to speed up the last part of this, since I'm always taking a little bit longer than I anticipate. So this next piece of it, I've been working on some educational. I'm hesitant to say educational research because I'm sure there's educational researchers who are much stronger in this area than I am. But some of the work that I've done has kind of filtered into this like parallel line, if you will. Again, as a reminder, in 2020, we have this new standard that said we have to implement social determinants of health and health literacy into our athletic training programs. Unfortunately, there wasn't much guidance given on how to do that, how often to do that. And so, again, we were left with trying to figure out ways to do that on our own. Now, coming from that student project before, we actually implemented it was a 3-part educational technique that modeled the CARD study that also gave us preliminary data for that National Athletic Training Grant Award. And so that was one of the first athletic training pieces that was actually very well received. There are programs across the country that have approached me and said, hey, we're using the educational technique that you guys published and did. Our students love it. It's been talked at national conferences in the past. And so that was kind of a starting point for some of these next in-line studies. A scoping review about social determinants of health and how to implement them in athletic training programs we felt was needed. But again, not much is out there. The study from 2020 that you can see here was included in that scoping review, but athletic training wise, that was the only article that was included that was within our profession. There wasn't anything from PT or OT either. It was mostly medical programs, some dental, and some pharmacology and nursing. So again, that scoping review, there's really a call to athletic training educators out there to say, hey, share with us, what are you doing? Disseminate what you're doing so we can learn from that. And then the reason I'm even mentioning some of this work is because this next study that's in preparation was also funded through internal grant funding. And it wouldn't have been possible if it weren't for that. And so I do want to acknowledge this work as well. So this last study that I want to talk about, let me go back here for a second, is really related to social determinants of health educational opportunities that are currently being conducted within athletic training education programs. So this was actually funded through one of the Warner grants. It was a mixed method study where we reached out to program directors to kind of get a very brief idea through a survey as to what they're doing within their programs to teach social determinants of health. We then, at the end of that brief survey, asked if they'd be willing to be interviewed so that we can get a deeper understanding of what was actually going on in these programs. So at the end of the day, we had 32 individuals that completed the survey. So the completion rate was about 65%. And then we ended up with 6 focus groups that 11 faculty ended up participating in. We were kind of hoping for more, but we ended up reaching saturation and getting some good information from who we ended up with. I don't expect you to be able to read that survey guide on the left. Again, that's small, so I kind of apologize there. But what really came about from this is that we are implementing social determinants of health in various ways within our athletic training programs, both didactically and through clinical exposure. Now, with the clinical exposure, it can't be tracked, or it isn't being tracked as maybe well as we hope. So that could be potentially a future direction item that should be addressed. There could be better and more effective assessment methods to gaining information on clinical exposure, as well as we also found, which aligns with the scoping review that we don't really know how we're assessing students' knowledge of social determinants of health. A lot of the times it's through reflection, which is great, but that doesn't necessarily always speak to the knowledge that the students have about the concept. So from this work to this point, athletic training educators need to kind of share what they're doing so that we can continue to build and grow what we're doing with this concept in our programs, and then filling the gaps and how do we assess. So I kind of just touched on the education piece and future direction. So I'll just quickly talk about what I would like to see happen with like the foundational research that I talked about earlier. I'm very interested in resource needs assessment at this point. I think athletic trainers are gaining an understanding that social determinants of health needs to be addressed. It is, for lack of better words right now, a hot topic. People are interested, they're paying attention, but they don't necessarily know how to assess or what to do once they do assess. So that's kind of the next direction I'm moving. I want to be able to provide the resources for athletic trainers to better their care and give them ideas of how to get creative with what they have. Not everybody can address all of these, and it's not, I don't think, expected by anyone, but what can we do to mitigate some of those negative influences when they are present? So thank you for letting me share some of my results and the work that I've done thus far. It is a passion of mine, and it always is fun to be able to talk a little bit about that. With that being said, some of this work wouldn't have been possible or completed as quickly or as well without some of the funding that I've received. Received external and internal funding that has been very appreciated. And so a couple of tips that I have for those of you looking to pursue is first, if you're like me, I love to brainstorm. I love to get the ideas out there. And sometimes I have difficult time reeling it in. And so I need some of those co-authors or co-collaborators to help with that. And so my first piece of advice is to really determine your research question and purpose. Once you can nail that down and have clear focused direction, it's really going to help you in terms of the writing and figuring out what grant calls are going to be fitting for the project you want to do. It's important to keep in mind that you should, and it's good to start small. You're not going to answer all the questions that you have and solve all the word problems in one research project with one grant, or two or three for that matter. But once you have your research question and purpose identified, really ensure that your project aligns with the call of the grant and the announcement. There are a number of different funding agencies out there, so anytime you can find the most fitting one, the better off and more successful you'll likely be. My third tip for you is to when you build your team, be very strategic about building that team. You want to ensure that the people that you invite to collaborate with you are really going to have a role and contribute to their greatest extent. A lot of the grant funding agencies are going to want to know who you're including in the line. So you want to have a content expert. You probably want to have an expert in the methodologies that you're going to pursue. It just shows the funding agencies that you're going to be successful in the project that you're pursuing. Once you know what grant you're applying for, start creating a timeline. Now, sponsored programs, when I've worked with them, they've been phenomenal, and they'll actually come up with a timeline for you to help direct and guide you. It's not just a timeline for the grant or writing the grant and submitting the grant itself, but what does the timeline look like from the moment when you're successful to get that funding? What does that look like moving forward? Communicating timelines with everyone's important as well. So don't keep that to yourself, and make sure everybody's on the same page with what you're going to get done when. Next, know your audience. Depending on what the funding agency or who the funding agency is, you've got to know who's going to be reviewing your work. If you're submitting for an internal grant here, it's going to be us. We are your peers here are those who are going to be reviewing it. Not everybody is in your profession, and that goes for external funding too. So you need to be able to write to speak to those people that are actually reviewing your grants. A number of grant agencies, maybe most of them, do provide a rubric so that you have that guidance right off the bat as to what they expect to be in there, but then again, potentially who you're writing to. You want to tell your story well enough that somebody outside of your field can understand and not have too many questions. The more questions they have, the less likely you are to be successful. My last perspective and personal tip here for you is do as much as possible ahead of time. Meaning, I guess, two things. Prior to actually submitting the grant, make sure you have pilot data that's usually looked very highly when you're submitting a grant. It shows that you can successfully complete what you say you're going to complete. And so getting that done ahead of time will help with securing the funding. But then even after, as soon as you get that funding, you can then hit the ground running. You're not waiting for IRBs to come through. You're not waiting for validation of surveys or any other methodologies you may be using reliability-wise. So do as much as possible ahead of time. And then I guess lastly will say don't give up. I've been successful, but I've also had experiences where I'm really excited and I think I'm going to submit something and then something falls through. It happens, and sometimes you don't get funded, but keep working at it. Don't give up. There's a lot of resources here within the university of people who will help get you in a place where you can be successful. And so these are another list of tips from other sources. Those before were kind of just my perspectives, but the starting early, getting familiar with the scoring criteria and knowing your audience, and don't give up. Learn from other people and pull people in. So many people here are willing to help. So don't hesitate and don't give up when you are pursuing those. Thank you to Research Nexus for having me first and foremost, but a lot of this, again, wouldn't be possible if it weren't for the co-authors, collaborators, researchers, and the students that I've been fortunate enough to work with. Everybody's been amazing. I've learned so much from so many different people, and again, it just wouldn't be possible without them. So thank you to them. And that is really all I have. So I don't know if there's time for questions, but if there is, I'm happy to answer them. But if not, again, thank you.
Thank you, Dr. Picha. We have two comments and one question in the chat. First of all, Dr. Freeman commends that achieved a 92% completion rate. That's astounding, as we all know, via first survey. The question he has is, might we be having similar issues, including SDHs in both athletic health environments and direct patient care settings?
Yeah, I think so. If I'm understanding, if I'm understanding the question correctly, I do think so. I think part of the athletic setting is athletic trainers. In some cases, are the first introduction to healthcare that some of our patients have, especially in the secondary school settings in more rural areas. They might not have a primary care physician as close as or as accessible as to somebody here. And so that athletic trainer is not only their athletic trainer, but it's almost like it's their primary care. And I shouldn't say it is their primary care, but they are the people that are going to try to help them get to different places within the healthcare system. So in some ways, I think athletic trainers, which I think some of the work shows, they're mitigating some of these social factors without knowing they're doing. So, for example, the college setting, many athletic trainers are going to either bring a physician to their patients, which takes away issues with transportation. And again, it just provides access sooner in some cases. And so without even sometimes thinking that we're addressing certain social factors, because of our presence, we are. But I do think, and I agree that there are going to be similar issues, either introducing social determinants of health or even mitigating social determinants of health in both settings. So that hopefully that answers your question.
I was thinking about the time limitations that exist in primary care particularly, and that if we have a defined amount of time and more questions to ask than can be answered within that time frame, might social determinants of health, notwithstanding their importance, take a back seat to some of the other questions that might appear more pressing related to the person's medical or clinical condition and maybe even their financial status. So that's why I was curious.
Oh, yes. No, I agree that I think it does. There's a study out there that actually kind of they surveyed physicians, and it was about whose job is it to address these, whose responsibility, because time's always a factor. And so deciding what do you address and when, and the physicians thought, yeah, it was important, but it was their job, but then it's not, whose is it? And so I think as healthcare providers, it's all of our jobs. Now, can we do it all? No, but how do we work together with the resources and community organizations that we have available to us? How do we work together to better the health for everyone? Right, easier said than done, but we have to at least pay attention and know when is appropriate to ask and find out further information. And if you're going to ask, you've got to have resources to back up what you're finding. So that's what I always, when I'm talking to the groups of athletic trainers that I have in the past, if you're going to ask these questions, make sure you have resources on hand or referrals that you're going to be able to give out, so that you don't ask and then don't have anything to do.
Thank you.
Any other questions for Dr. Picha from the audience? And Dr. Jackson thanks you for the tips, so as you noted. I do have a question. From your second study of the card study of 80s, I was surprised that a lesser proportion of college ATs addressed social determinants compared to the school ATs, which I will believe is less under-resourced than colleges.
Yeah, I agree with you. Interesting finding. Now, I think part of that is because, again, they're doing some of these things that they're not even, it's been part of our job for so long that they're not thinking about the fact that they just took out transportation as a social determinant of health for their patients because they're bringing in physicians to see them. They aren't thinking about the fact that they have a dietitian on site, and some of the D1 athletes can just go grab a snack before or after practice. So there is, I think, something to be said about the presence of athletic trainers in the college setting, not putting a name to some of the things they're doing yet. But they do a really good job of some of those things, so we don't have to think about it. So I think there's already so many resources in those settings that are available to them that just kind of take out the fact that they have to, not that they have to do anything extra, but it's that they're already doing it, so the access is different. So I think that might be part of it. They're either not thinking about what they're doing because they've done it for so long so well, or again, it's the resources. They have different resources than a secondary school athletic trainer would.
Do you think there has to be a component of making the students aware of the resources beforehand so that they can ask for them in case that opportunity is missed by the provider?
You're asking about like the patients?
The patients, yeah.
I think that's a really good question. I guess I would almost think about like if you go to the doctor's office and you're going for an injury or because you're sick, are you thinking about the other things that might be preventing or contributing to your health? I don't know that we can expect that of our patients. I think the more education we provide to them, that is going to improve their health literacy overall. And again, I think athletic trainers do a really good job about explaining injuries and conditions to their patients, but also helping them navigate the healthcare system in a lot of ways. But I don't know how you would get patients to pay attention to some of those things or have the awareness that they're impacting their health before they get to you. Am I understanding your question correctly?
Yes, absolutely. Yeah.
I would love to say yes. When they come in, they're going to know what's impacting their health at home. But I don't think that's realistic. I think as healthcare providers, the more knowledgeable we are about the social determinants of health and how they impact, we can either ask those questions and start identifying where we can help out when we can. I don't know that we can expect them to be knowledgeable enough to know what to ask related to them. In some cases, they might be. I don't know if anybody else has thoughts on that. I would love to hear if we do.
Dr. Jackson has her hand up.
Thank you so much. Thank you, Dr. Picha. It's such an interesting talk. I learned a lot. I'm wondering, to kind of Dr. Friedman's comment, is there an opportunity, are there any tools out there that the patient can, fill out while they're waiting to see their primary, or anybody that, you could have that assessed at, by the medical technician or somebody to say, oh, this person is facing food insecurity or whatever it might be. So the physician or the provider isn't not wasting time, but spending time asking the questions or assessing the questions, but coming already in. Is there any tools out there, or is that something maybe we could develop?
Great question. There are. I think yes and yes to both of those questions. There is a family practice. I forgot the acronym, but there's a family practice outcome questionnaire that can be used. Some medical record systems have questionnaires implemented already. Whether they're used or not, I'm not sure. Thank you, Dr. Freeman. You did include the Prepare tool. That's another great one. The Healthy Leads has a screening tool that you can that has several standard questions, but then you can include others depending on your population, what those patients might need. There's one on substance abuse. There's one on more in-depth on social support. And from some of the reading I've done, you can take some of those questionnaires and again, continue to modify it for your patient population. I would love to see a tool that could be used in the secondary school or collegiate setting for the athletic population, and that's kind of one of the directions I'd like to go. However, there are plenty out there, so it might just be picking and choosing, doing it in a pre-participation physical or having an MA administer it before. It could go to a patient's email. It's just, will they fill it out before they get there or not? But I do think that would be probably the best time to save people's time would be before they even reach the physicians, and having somebody flag when something needs to be addressed. There's even questions in some of those tools that. It's like, do you want your primary care, or do you want somebody to follow up with you on the questions? And then I think in some places they have social workers that'll follow up with certain resources. And I think that just needs to continue being built upon, so that we can get people to the resources, the community resources that we have access to. Not just it looks different in every community.
Yeah.
Like
Nice. Yeah. Thank you.
We have two more questions, Dr. Picha, from Dr. Hassan. He asks if the 92% completion rate was due to the class of participants. And the second is, what can we expect from patients in general population in terms of social determinants of health knowledge?
Yeah, again, we were really happy with that completion rate. Now, the survey itself went up to 17,000 athletic trainers, and the access rate was about 11%. So out of that 17,000, 11% accessed it, but the completion rate from those who accessed it was a lot higher. And with that, it wasn't sent out once. There was 2 reminder emails as well that I think helped a little bit with that. But I also have been a part of other surveys that just they didn't have that high of a completion rate. So I'm not sure we did anything too special other than following some of the guidelines through the National Athletic Trainers Association. They paid them to send it out. So we were very pleased with that. I just completed a survey that was a lot, working with a group that was a lot less than that. And then what can we expect from patients of the general population? In regards to what exactly? The survey that we administered was 2 athletic trainers, 2 clinicians. Do you mind clarifying your question? I'm sorry, I'm not sure.
Dr. Hassan, can you unmute yourself and clarify the question, please? Oh, okay.
Oh, okay. So you're talking about the questionnaires that patients would fill out? Because I haven't gotten quite, okay, perfect. So with the tools that I'm aware of that are out there, a lot of them are at a lower reading level because that is what the general population is at for understanding of and related to completion of them. With the 92%, that was a survey to clinicians, and that wasn't evaluating their social determinants of health. It was more about their perceptions and knowledge and how they are experiencing social determinants of health within their patient population. So in regards to if we're going to administer a questionnaire survey related to social determinants of health patients are experiencing, I absolutely think it has to be at a lower reading level, because looking at the US as a whole, the reading level is pretty I don't know the exact number, but I think it should be like an 8th grade reading level, if I recall correctly. And so I think that's part of it. I think the other part of it is it can't be 100 questions long. You're going to lose people so fast. So that's something to consider too. Maybe pick a handful that your community might be more apt to be impacted by in a negative way, and then ask about those to get more patients to complete those forms, and then just be ready to have those resources available and know how you would address them or where to point them. I hope that answers your question. I would agree. That's a great comment, Dr. Freeman. Yes. So depending on those that are participating in athletics, you got to consider where they're coming from. Absolutely. I think that that point alone, just to me, it says you have to know your population of people. Whether it's a secondary school setting, again, are you in a rural area or are you in our city? Like, where are you? You have to understand your community. University settings, college settings, there could be a little bit more difficult because you have student athletes coming from all over the place, but you still have to have an understanding of who they are and what they have access to. Great point.
So it's a top of the hour again. So if nobody has any more questions, then we'll call it good. Thank you, Dr. Picha, again. This is Dr. Picha's third time presenting to us. So, yeah. So thank you so very much. And I hope to have you again and enlighten us with what you find with your third study.
Thank you. I appreciate it.